Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an informative and exciting show for you this evening. We're talking about varicose veins and EVLT procedures, and we'll be discussing what services are best suited for patients when determining their care. We'll be joined by a panel of medical experts from vascular surgery and obstetrics and gynecology. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at vascular screenings with St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have an accomplished panel of guests joining us tonight. Up first, we have Dr. Lynn Doctor. Dr. Lynn wanted to become a vascular surgeon because of the variety of patients she gets to treat. Vascular disease is a long-term illness, so she's able to build strong relationships with her patients. As a vascular surgeon, Dr. Lynn treats the arteries and veins throughout the body, which covers a broad spectrum of diseases. Her goal is to work with patients, their families, and other doctors with a team approach to provide the best and most evidence-based treatment possible. In her free time, Dr. Lynn enjoys cooking, yoga, and sewing.
My name is Dr. Lynn Doctor, but my patients call me Dr. Lynn, and I'm a vascular surgeon here at St. Luke's. I first became interested in vascular surgery during medical school with some amazing mentors, and they really got me into the field and looking at research and procedures and technology and all the things that come with vascular surgery. So one of the things I love about treating vascular patients is that I treat you from the very beginning when we first find it to when we might need to do a surgery to help treat it, and then for surveillance afterward. So I really get to see you from the beginning to the end. I love being able to help my patients because you can make such a big difference in their lives. I can have somebody who comes in and can't walk or can't play with their grandchildren, and after their procedure, I can see them walk out of the hospital pain-free. I love what I do because I get to help so many different people in different ways, or sometimes I get to prevent them from having a stroke and give them lots of years with their family.
Thanks for being here, Dr. Lynn.
Thanks for having me.
As a vascular surgeon, what are the most common reasons patients are coming in to see you?
Patients come in for a lot of different reasons, but we're working with the arteries and the veins. So anything to do with blockages in the arteries or trouble with the veins are some of the most common.
And how does a patient know if that's something that they need help with? Is that always emergent, or is it something that maybe they're referred to you?
It can happen either way. Sometimes patients don't know that they have a vascular problem. So starting with your primary care doctor is always a good way to go. And then when they feel like a vascular surgeon needs to be involved, they will refer the patient to us, and we're happy to see them and try to figure out in a more detailed way what's going on.
Great information. Thanks, Dr. Lynn. Joining our panel next is Dr. Charlie DiMaggio. Dr. DiMaggio is a board-certified practicing vascular surgeon and is also board-certified in general and surgical critical care. He's skilled in both minimally invasive surgery as well as traditional open surgery. Dr. DiMaggio ensures that all of his patients are treated as family. As a physician, he considers himself privileged to be entrusted with the care of his patients. Outside of work, Dr. DiMaggio enjoys reading, traveling, working on various house projects, and spending time with his wife and 2 little boys.
My name is Dr. Calogero DiMaggio. I am a vascular surgeon here at St. Luke's. I first became interested in vascular surgery as a medical student. I'm particularly interested in the endovascular, or considered the minimally invasive surgery. The vascular system actually includes both veins and the arteries. We can see folks for varicose veins. We could also treat them for potential stroke, as well as enlargement of the vessels, or what we consider aneurysms. What we see primarily in our practice is folks who are diabetic, high cholesterol. It's important to be educated on their vascular health because it's all connected and interrelated. I love getting patients back to doing the activities that they love. I joined St. Luke's as a vascular surgeon in 2015, and it's been a great network to be part of. We, as vascular surgeons, work in close collaboration with the cardiologists, the kidney doctors, as well as the primary care physicians, and that unique collaboration allows us to deliver the best care for our patients.
Welcome, Dr. DiMaggio. Thanks for being here.
Thank you for having me.
What drew you to vascular surgery and what makes it interesting to you day in and day out?
I got involved with vascular surgery as a medical student. I got to work in close collaboration with one of the vascular surgeons. And what drew me to vascular surgery is the complexity of our patients. So they have a wide variety of vascular pathology, and you really get to work in close collaboration with different disciplines such as the cardiologist, nephrologist, and the primary care physician.
Thanks, Dr. DiMaggio. Let's meet our final panelist, Dr. Richard Baker. Dr. Baker is a board-certified OBGYN and a fellow of the American College of Obstetricians and Gynecologists. He's also a member of the Pennsylvania and the Northampton County Medical Societies. Dr. Baker believes patients need to be heard, understood, and treated in a compassionate and respectful manner. For a pregnancy, his goal is to provide a truly memorable and safe experience for the patient and her family. Dr. Baker enjoys spending time with his wife and 5 kids. He loves children and hopefully will be blessed with grandchildren in the near future. In his free time, Dr. Baker enjoys photography, music, movies, and getting out in nature.
I'm Dr. Richard Baker. I'm one of the staff gynecologists here at St. Luke's. I have always been interested in life and just a beating heart. How does a heart beat without ever resting? Or how does one go to sleep and then wake up? Obstetrics and gynecology, it's kind of a combination of family practice, and you get to forge lifelong relationships with patients. I have 3 generations of patients I take care of. It's a time that can be very anxiety-provoking for a couple. Am I going to survive this process? Is my baby going to be okay? Is my baby going to be healthy? And just making sure everybody feels comfortable and they trust you in the process, that everything's going to be okay at the end. Here at St. Luke's, really, you have everything you need to get excellent care. Obstetrician gynecologists that take care of you. We have maternal fetal medicine people. One of the reasons I love St. Luke's is the ability to teach. Teaching young physicians during residency and medical students, it's very stimulating. It makes you feel young, and it also keeps you up to date because you need to be able to teach them, things that are state of the art.
Welcome, Dr. Baker. Thanks for being with us.
Thank you, Ashley. It's nice to be here.
Tell me what it is you love about the field of obstetrics and gynecology.
But the field of obstetrics and gynecology is kind of a meld of family practice, general surgery, and obstetrics. We have lifelong relationships with patients and families. I have 3 generations of one family that I take care multiple times in my career. You get to do surgery. We help women when medical management fails. We get to perform surgery. I like to use my hands. And then handing a couple a newborn, especially their first child, is really the nicest feeling in the world. It never gets old. It's always special.
And it is such an amazing moment in someone's life to have that child, especially that first child. So thank you guys so much for giving us all of your background information and teaching us a little bit more about your expertise. Next, we'll dig deeper into varicose veins and how they are treated. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
My name's Courtney Fanzaw, and I'm a mother of 3. I first noticed the varicose veins when I first got pregnant with my second child, and when they didn't go away, and my legs were still heavy and tired and painful, and was afraid to wear shorts and dresses, I knew it was time to get help. I chose St. Luke's because I've always had great experience there. I delivered all 3 children with St. Luke's, and I knew there's someone I could trust. Dr. DiMaggio was so helpful for me and my family before and after the surgery. On the day of my surgery, I was a little nervous, but the recovery process was really great. I was able to go to Disney World the week after having it done. I'm grateful for St. Luke's for resolving the problems with my varicose veins. I'm not worrying about the way I look. I'm feeling great. I'm able to do the things that I used to be able to do and wear shorts and not have to think about it anymore.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for watching our program and for providing us with questions for our panel before the show. Joining me is a talented group of medical professionals, Dr. Lynn, Dr. DiMaggio, and Dr. Baker. We've started to discuss the basics of each of your disciplines. Now we'd like to get a better understanding of varicose veins and procedures to treat them. Dr. Lynn, I'm going to get started with you. What are varicose veins and why do they occur?
So varicose veins basically means an enlargement of the veins. They can occur for many reasons. Sometimes they just happen. You're born with them. Sometimes you have a family history and it's genetic. And sometimes something can cause them, like surgery or even being pregnant and having a baby. The veins aren't acting the way they should be, and they aren't transporting blood appropriately. And so sometimes you need to have that treated surgically or medically.
Yeah, you bring up surgically, and I know that they can often cause pain for people. Dr. DiMaggio, what is an EVLT procedure and how does it treat varicose veins?
EVLT stands for endovenous laser therapy or treatment. And what it typically does is the procedure itself actually introduces a small laser fiber into the vein, and it actually delivers thermal energy to help close that vein down. And so in essence, the effect of it is preventing blood flow through that vein and redirecting it through healthier veins.
When the varicose veins are happening in patients, Dr. Baker, why do women seem to be more at risk during pregnancy and their life cycle to develop varicose veins? Why is it a bigger concern for women?
The venous pressure in the lower extremities increases about 2.5-fold. So you have the 9 months of the pregnancy with that extended pressure. It causes dilatation of the veins, basically they're herniations, and the veins become tortuous, elongated in the subcutaneous area, and they can become quite painful. And it's usually that will recur with each pregnancy.
So your odds of it getting worse can increase with each pregnancy if it's something that you're predisposed to get.
Right. There's a family history, as alluded to. If both your parents have varicose veins, you have about a 90% chance of developing varicose veins. If one of your parents has varicose veins and you're a woman, you have a 60% chance of developing varicose veins, while as when you're a man, it's only about 25%. There's usually a 2-to-1 ratio, women to men, as far as varicose veins, and the most common reason is probably pregnancy.
Dr. Lynn, you mentioned several reasons people might develop varicose veins, and what role does diet and exercise play in benefiting patients who might be experiencing vascular issues, not just varicose veins, but any vascular issues?
So good diet and exercise is always really important. Exercise is actually one of the treatments for many vascular diseases. So it's part of the treatment for varicose veins, and it's also part of the treatment for atherosclerosis or blockages in the arteries. Diet also contributes to that, so making sure that you eat a low-fat, low-cholesterol diet, as long as that works with your other medical problems, is really important.
Dr. Maggio, you mentioned an EVLT, but what treatment is needed prior to getting that procedure or knowing if that procedure is necessary for you?
So typically when we see patients in the office, we'll obviously do a history and physical. And then on that history and physical, it'll be quite apparent whether somebody has varicose veins or other manifestations of chronic venous disease. But prior to proceeding with an EVLT procedure, we'll get what's called a venous reflux study, which is assessing for incompetence or weakened valves within the veins. And so that would be one of the prerequisites of proceeding or prior to getting an EVLT.
Dr. Baker, how often are you referring patients as an OBGYN to the vascular center, to a vascular surgeon for help with varicose veins or any other vascular issues?
It's actually quite common. So we try to be conservative, compression socks, raising the legs. But if that fails, we'll usually refer people.
And Dr. Lynn, how do you work together with the OBGYNs or the family practice doctors to ensure kind of continuity of care of your patients once they're referred over to you?
Well, once they're referred over to us, it's generally because they're having a problem and it's not going away. So we make sure to get them started on the right medical management as we work towards figuring out whether they're a good surgical candidate. And then, of course, we always communicate back to whoever referred them, whether that be their primary care provider or their OB-GYN, so that we can have a discussion about their care and what's appropriate for them. It's also important to talk to the patient about whether or not they plan further pregnancies, because it's best to get your veins treated after you've completed having all of your children.
Really insightful information from all of you, but we're not done yet. After the break, we'll learn more about treatment options and recovery time. You're watching St. Luke's Health Now. Stay tuned. Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an intriguing show for you tonight. We're talking about varicose veins and EVLT procedures. In case you're just tuning in, I'm joined by three St. Luke's medical professionals, Dr. Lynn, Dr. DiMaggio, and Dr. Baker. Thank you all for being here. In the first part of the program, we talked about some background information from each of your disciplines and what varicose veins are. Now I'd like to dive into treatment options and patient care. Dr. Baker, Dr. Lynn was mentioning getting veins treated after you've completed pregnancies. When is the best time for a woman to look at getting her veins treated? What do you recommend?
Typically when you're done having your family, and you want to make sure of that, because if you're treated and then you have an accidental pregnancy, you may have a recurrence of the venous problems again. So yeah, definitely when they've finished their families and they failed conservative therapy. Usually in the 40s, between 40 and 49 is when women complain about varicose veins the most.
Dr. DiMaggio, when you're performing an EVLT, what is the goal for the patient and how successful is it? What can people expect as the outcome?
So the expected outcome is there's resolution of pain associated with varicosities. The way we have been performing the procedures here is in the operating room, where we perform the endovenous laser procedure as well as then combine that with phlebectomy, which is removal of the varicosities through small incisions. And so the expected goal is to, have resolution of their symptoms, which may range from just painful bulging varicosities to itching to they may have some skin changes associated with the varicosities. And the success rate of the endovenous procedure is quite high. It's in the high 90s in terms of percentage-wise that you'll get closure of that vein and subsequent relief from your symptoms.
We're talking about varicose veins, but there are lots of other vascular issues that you deal with, Dr. Lynn. Can you tell me a little bit about the types of vascular disease that you treat and other things people can control to help maybe alleviate some of those problems that they might be experiencing? You mentioned diet before. What about smoking or other things they can control?
That's a big question. So vascular disease basically covers anything to do with the arteries and the veins. So there are a lot of different things we treat: blockages in the arteries, enlargement of the arteries called aneurysms, as well as some of the venous disease we've been talking about, like venous insufficiency or even blood clots in the veins, like a DVT. There are many things that we can do to control that, even without surgery. Things like stopping smoking is really key to preventing those blockages from getting worse or from preventing further blood clots. Diet and exercise we mentioned briefly before, but those can also help with your disease. And then some easy medications that we can get started as well. And when all those things fail, then we talk about doing surgery.
So it's really a last approach and trying to look at those lifestyle pieces. Dr. Baker, you're talking about caring for patients through so much of their life and many generations often. How important and what role do you play in that overall health and wellness of your female patients that maybe would help prevent them having to see a vascular surgeon in the first place?
Well, as soon as you start to see varicose veins when they're small, recommending compression socks can help prevent the progression in certain patients. Just trying to identify these things early. We always recommend exercising 3 times a week for not just vascular issues, but osteoporosis prevention and things like that. But I guess for me and the PCP, the family physicians, it's if you notice something early, to try to act on it, to try to make changes so that if it advances, patients can be referred promptly and before this gets to the point where they have chronic problems and stasis ulcers and skin changes that can be very debilitating.
Well, you mentioned being referred, and I know one of the things that's fearful is people thinking they have to see a specialist, they're going to need a procedure. You all have mentioned many other techniques that are used before you get to EVLT, but if it does come to that, Dr. DiMaggio, what does recovery look like for a patient, and how concerned do they need to be about getting the consult in the first place?
Every vascular surgeon has their own nuance in doing this, but we'll typically put a dressing on their leg that extends from the foot up to the thigh. And then either we tell them to keep that in place until we see them back in the office the following week, or we tell them after 2 or 3 days to go ahead and remove it on their own. So they should anticipate a little bit of bruising, especially if we do the phlebectomy portion of the procedure. That would resolve over the next week or 10 days. And then we expect them to be back to work, probably within a week would be a safe time that most folks are back to work.
So pretty doable, nothing to be too scared of. Dr. Lin, what do you want people to know about their vascular health and how to be educated on it? It's often something that maybe we aren't familiar with until we have a problem.
I think that's absolutely right. Many people don't even know what a vascular surgeon does until they get referred to one or they start having vascular issues. But coming to see us is nothing to be scared about. Just like Dr. Baker, we see our patients for a lifetime. Once you come to vascular surgery, you're a patient of ours forever. And we can coach you through everything from just talking about your mild vascular disease to talking about how to screen and surveil to watch out for it getting worse. And then finally, if it's bad enough and you need surgery, we'll help you in that way as well.
Thank you all for such an engaging conversation. Up next, questions from our viewers. Stick with us. You're watching St. Luke's Health Now. Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation about varicose veins and EVLT procedures at St. Luke's. All right, now we're going to take some questions from our viewers. Here's what we've got first. Dr. Baker, I think this is for you. How do I get a family member to go see a vascular surgeon if they don't think they need one?
Well, what I commonly do is I'll print out something on vascular disease and the potential complications or problems if this is ignored. I'll print that for the patient. They can take it home. I just say, this is something that's not going to get better unless it's addressed. And it's better to address it now when you're young and healthy as opposed 10 years from now when it might take twice as much effort to fix and you may not be as healthy to tolerate the procedure.
Well, certainly educating your family member, educating yourself, and just spreading the information is the best you can do. All right, Dr. DiMaggio, I have a question. I think that's a good one for you. I'm scared that getting my varicose veins removed will hurt. What's the process like and how painful is it?
It's a same-day procedure, so folks get to go home the same day. When we do the procedure, we actually put some local anesthetic where we actually end up doing the laser. And most folks complain of some mild discomfort along the medial thigh and where the varicose veins were. So usually the pain is controlled with just some anti-inflammatories such as Advil or ibuprofen. And then once the dressing comes off, as I previously mentioned, they should anticipate some bruising that will dissipate over the next week or so. But for the most part, it's pretty well tolerated with minimal pain.
That doesn't sound too bad, so that's a good answer. All right, Dr. Lin, I have a question for you. This viewer writes in, if I have my varicose veins removed, can they come back and are they preventable in the first place?
So venous disease is unfortunately a long-term issue. Even if you have your veins removed, it is possible that they could come back. Some of the things that you can do to help prevent varicose veins from returning are keeping up with your compression socks. I just can't emphasize enough how helpful they are in reducing the swelling and your symptoms and also preventing new varicose veins. Other things that you can do are elevating your legs and exercise and making sure you keep a healthy weight.
Excellent, great. All right, Dr. Baker, this viewer writes in, I've never been pregnant before. What are my risk factors of getting varicose veins?
Being a woman in general, I think, increases the risk over a man. Age, these tend to increase as people get older. It depends on what type of job she has. If she's standing in a warehouse for 8 hours a day, prolonged standing increases your risk. And then family history. You can't modify your family history. And as I alluded to earlier, if both of your parents have varicose veins, you have a 90% chance of getting varicose veins.
Dr. DiMaggio, this viewer asks and says this: I don't have varicose veins, but I'm concerned that I could have vascular disease. Are there any screening options I can undergo?
Well, in regards to vascular disease in general, yes, it would depend on if they're having any symptoms. So again, as Dr. Lin has alluded to, we treat both disease in the arteries and the veins. So some folks will have symptoms that really point us in the direction of having an arterial problem. And then obviously what we've been talking about today is there's that whole venous component with varicose veins, whether it be an ulcer that's not healing or skin changes. So it depends on what the patient presents with and what their history is.
Great. Okay, I think we have time for one more question. Dr. Lin, for you, this viewer writes, what are warning signs that I could be aware of and need to pay attention to that may indicate I have vascular disease?
So a couple of warning signs. When we're talking about venous disease, you might notice that your veins start to bulge, that you have swelling in your legs, or that they start to feel very heavy and tired at the end of the day. As far as the arterial side, some of the first signs of arterial disease in the legs could be cramping in the calves when you're trying to walk, particularly uphill. Any signs of a stroke could also indicate vascular disease in the carotid arteries, which run in the neck. And if you have a family history of vascular disease, sometimes that can be a good reason to come and see us and figure out if there are any tests that need to be done.
Great. Well, thank you all so much for joining us for this wonderful, insightful conversation. We really appreciate your time and your expertise. Thanks for joining us. For more information on varicose veins and EVLT procedures at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-St. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.